back to work, back to play.
Hey, Dr. Novables here to give you some evidence-based exercises to heal tarsal tunnel syndrome quickly. So these 5 exercises are great. I'll go ahead and show you what tarsal tunnel syndrome is, and then we'll jump into those exercises so that you can really do it yourself and get the best results with your care. So now I'm going to go ahead and point out where you may feel pain if you have tarsal tunnel syndrome. So oftentimes pain is experienced right through here. So kind of right between the inner ankle and the heel, right in this area here. And it usually kind of goes down into the sole of the foot. Another way you can tell if this is a true tarsal tunnel syndrome is by actually moving the foot in. So kind of bringing the heel in, the ankle in, and that will often compress this area right here, and that can bring on some of the symptoms of tarsal tunnel syndrome. So if you have those, then that's an indication that these exercises that we're going through are going to be really beneficial. So we'll go ahead and go through those now. So our first exercise is the standing calf stretch, and this actually works more on the gastrocnemius, which is one part of the calf. So this is going to be our stability foot, and then this is going to be the foot that we're actually stretching. So she'll go ahead and bring the foot back so she's onto the ball of the foot here. And then she's going to lower the heel down on a count of 7, bringing the heel down as low as possible. And then once she gets to the bottom there, she's going to take a moment and just kind of relax and then contract the calf as much as possible, and then see if she can lower a little bit more, and then contract the calf again and lower. And we'll do 3 of those contract relax cycles, and then go ahead and bring the heel back up and come out of the exercise. And so we want to do 3 of those contract relax cycles, and then also do 3 reps on that one side, and then we would switch to the other side. So that's the standing calf stretch exercise. That's our first exercise in the tarsal tunnel syndrome exercise series. All right, so our second exercise is similar to the first exercise. It's a standing calf stretch, but this time we're focused on the soleus. And so in order to get the soleus muscle of the calf, we need to keep the knee bent. So that makes it a little bit more complicated. So go ahead and step your foot back. Again, keep this knee bent. And you'll also have to bend the other knee quite a bit in order to do that. And then just like the last one, lowering the heel down on a count of 7. And then when you get to the bottom, engage the calf a little bit, good. And then lower it again. And then engaging the calf a little bit. And then lowering again, good. So we'll do that contract relax cycle again 3 times in a row. And then after that 3rd one, you can go ahead and come all the way up. And we'll do 3 sets of those on each side. And then you can do that up to 2 times a day. So that's the second exercise. That's the standing soleus calf stretch. That's our second exercise for the tibial tendon dysfunction exercise series. Okay, so our 3rd exercise we're calling the resisted sole to sky exercise. And so what that means is that the sole of the foot is going to lift up towards the sole of the sky. So we've already set that up here. We have our band, our CLX band, and it's stretching down onto the opposite foot that's on the floor. The legs are crossed in this figure 4 position. And so the actual exercise is the resistance is pulling the foot down, and then we're going to bring the foot up, bringing the sole of the foot towards the sky, and then it'll naturally pull the foot back down, and then we're going to lift the foot up, bringing the sole of the foot up towards the sky. So we're going to do that 10 times on the side that's being affected, and we're going to do 3 sets of 10 reps, just pulling the foot up towards the sky. You can vary the resistance of the band, either doubling up on the CX band or getting a band that has more resistance, depending on how challenging this is. So this is our 3rd exercise in the series. So our next exercise is the posterior tibial nerve floss. And in this exercise, we have the tension here on the foot. It's pulling the toes back towards the ankle. It's kind of drawing the whole foot back towards the ankle. And then we're gonna go ahead and bring the knee up here as we pull on the toes. And this is really gentle, but you'll wanna feel a little stretch right through the posterior tibial tarsal tunnel here. So go ahead and bring the foot back down, and you'll just keep doing that exercise, bringing the knee up, the foot up off the table or off the floor as you pull here. And we're gonna do 10 reps of this and do 3 sets. Naturally, it's always good to do these exercises on both sides, but you really only need to do them on the one side where you're actually having this discomfort. Just for symmetry's sake, it's good. Oftentimes we have compensations on the other side. So that is the posterior tibial nerve floss. All right, so our last exercise is the ankle alphabet. And so this is pretty simple. You can do uppercase or lowercase letters, whatever you decide. And so we'll go ahead and start, and we'll just have Laura move through these different letters of the alphabet. And as you can see, she's using her ankle as much as possible to really articulate all of these different letters. Everybody who does this, it's going to look a little bit different. You want to go all the way through the alphabet with your ankle, really noticing all of the different places in the ankle. And this will strengthen the ankle and will help you to feel a lot better. So this is the last of the exercises in the series. Thank you so much for watching. All right, so we just went through those 5 exercises for tarsal tunnel syndrome. And after doing these exercises the first time, you can expect to get some relief. If you do these exercises for longer than 7 days and you're not having any effect at all, or it's making things worse, it's time to stop the exercises and go see your healthcare professional and figure out what is going on. If you're coming here to the office at Proactive, we're happy to go ahead and assess you at one of our normal visits. If you're not currently a patient here and you're having some foot pain, feel free to set up one of our 15-minute free consultations. We're happy to take a look at things. Or if you're doing the exercises and are not quite sure if you're doing them right, we're also happy to watch you do them, give you some modifications, either make it more complicated or less complicated, depending on what we see and using our expertise. So thank you so much for watching this video. Exercise is a great way to be proactive about your health and to keep yourself out of the doctor's office, including ours. Thanks again.
Subscribe Proactive Chiropractic.